Good morning. Good morning to the West Coast and good afternoon to the East Coast. Thanks for joining us today for our Code for America Summit webinar, Delivering a Human-Centered Social Safety Net in a Time of Crisis. I'm Dan Hon, co-chair of the 2020 Code for America Summit. At Code for America, we believe that the two biggest levers for improving people's lives at scale are technology and government. We put them together and we help government work for the people who need it most. The Code for America community brings together our favorite kind of person, one who's committed to bringing new ideas, collaborating across old silos, and doing the hard work for the long haul to change people's lives for the better right now. Over the last 10 years, Code for America and our partners have adapted and changed as we've learned more about what our colleagues, residents, and citizens need. And we've developed philosophies and practices that can and are being put into action at all levels of government. We look forward to continuing to share valuable content, both from leaders at Code for America and those we admire and respect in the community at large. And we want to learn more about what topics and issues matter most to you. Before we begin today's webinar, a few important housekeeping points. Our code of conduct applies as much online as it does in physical space. We expect today's session to be a safe and respectful environment for everyone and a place where people are fully able to express their identities. Check our chat for a link if you'd like to review our code of conduct. If you are being harassed or noticed someone else being harassed or have any other concerns, please message Marissa or Contasia on Zoom chat, or you can also send an email to safespace@codeforamerica.org. We'd love for you all to participate in today's session. As we start now, we'll be running a poll to get a sense of who's in the room. And to engage with us throughout the panel, you'll notice two buttons at the bottom of the screen, chat and Q&A. If you're on mobile, click on participants to see chat. In chat, we encourage you to share your thoughts or where you're from and why you joined today. You can also direct message individuals. Toggle who you're sending to, and please message our two Code for America hosts, Contasia or Marissa, if you need any help. And then for the Q&A throughout this morning's session, you can submit questions by clicking the Q&A button at the bottom of your Zoom screen. You can also see the questions that other people are asking and also vote for them so we know what the most popular questions are. Only questions asked through the Q&A will be considered and we'll take a look at to be asked of our panelists. As usual, we also welcome your tweets. Find us at Code for America or use the CFA Summit hashtag. And stay tuned later this week for an email with the YouTube video of today's session. Now, before we jump into our chat with our panelists today, I'd like to set the stage a little bit. It's clear that we are in an emergency and a crisis situation. In just over a month since Friday, the 13th of March, over 22 million Americans have filed for unemployment aid, and over 26 million Americans have been laid off or furloughed. This morning, on the 22nd of April, the Labor Department reported that more than 4.4 million Americans filed for unemployment benefits in just the last week. In January this year, the expected statistic was that around 55% of Americans would touch the social safety net at some point in their lives for healthcare, food assistance, or economic support in times of need. It's clear that that has radically changed in just the space of a couple of months. In March, Code for America's Get CalFresh team found that nearly 50% of applicants in California right now were applying for SNAP, for food stamps for the first time, with 4 times more applicants than usual. In today's session, our speakers today have spent their careers improving outcomes in the delivery of government services, and especially taking a human-centered approach. So we're going to be talking today about how social service organizations are meeting the unique challenge that we have in this time of crisis. If you're unfamiliar with human-centered design, or its newer and trendier incarnation in design thinking, I can imagine feeling that being human-centered might be either something obvious, because who isn't being human-centered in this field of work, or that being human-centered can be discarded in a time of crisis because there's real work to be done. And of course, why else wouldn't we be human-centered? Why else would we be working in social services? What we hope to bring out in discussion with our panelists today is how being human-centered is an essential North Star during a crisis like this one. If we're going to make a difference to tens of millions of people in need and make sure that our society's support structures are up to the task, then we need to make sure that we are being human-centered for both applicants, benefit recipients, and the people doing the work to deliver those benefits all at the same time. And to set the tone, I've got two quotes that the Code for America team have received from applicants for social safety net services in the last few days. These quotes remind us all about the very human and very real challenges that people are facing. Here's the first one. I was just temporarily let go from my job due to the worldwide pandemic. I'm currently waiting for unemployment, but in the meantime have no money or food to buy groceries. Here's the second one. I had missed a call from a Department of Public Social Services worker, but they didn't leave a message for me to call back. I attempted many times to call the customer service line, but due to extreme call volume, I wasn't able to hold. Now, a week or so later, due to COVID-19, that customer service department is closed. On that note, we're incredibly proud to bring together today's panel to discuss a human-centered social safety net. The social safety net systems and programs provided up by our governments have always been important, and in a crisis, their role is critical. When we talk about a human-centered social safety net today, we'll be looking at how being human-centered means understanding and meeting the needs not only of the people applying for and receiving help, but the frontline workers who are also working in an equally traumatic situation and are needed to make those services possible. Our goal today is to leave you inspired by the work of our panelists, committed to a human-centered approach to your efforts, and with tangible, real advice and information that you can put to work. And now I'd like to introduce today's panelists. In alphabetical order, joining us today are Tracy Patterson, Senior Director of Social Safety Net at Code for America. Tracy is the former Director of Engagement and Strategy for California Policy Advocates, and at Code for America, she leads the Safety Net program portfolio with a focus on improving the outcomes, access, and delivery of social safety net programs like Medicaid, SNAP, and TANF across 6 US states. And those programs have helped over 1 million people access safety net benefits. Next up, we have Leo Ribes, partner at Change and Innovate Agency. Leo works side by side with staff and leaders in 20 states, improving social service outcomes, and was the former Director for Community Services in Washington State. We also have Robert Thompson, Deputy Administrator at the Nevada Department of Health and Human Services at the Division of Welfare and Supportive Services. In the state of Nevada, Robert is responsible for policy and program administration for SNAP and TANF, Medicaid, and more. And lastly, introducing Jen Wagner, Senior Policy Analyst at the Center on Budget and Policy Priorities. At CBPP, Jen focuses mainly on Medicaid eligibility and implementation of the Affordable Care Act, looking for opportunities to align Medicaid with other low-income support programs. So, good morning to Tracy, Leo, Robert, and Jen. Hi. Feel free to unmute yourselves all now. So,
Good morning.
Good morning.
Good morning.
For today's session, I'm going to bring up about 4 or 5 broad topics, and I'm going to invite each of our panelists to respond to each question, but also Jen, Leo, Robert, and Tracy, feel free to chime in where you think it's appropriate to contribute. And to get started and to get a sense of where everyone is starting from, I'd like to ask each of you, starting with Jen at CBPP, what's the current state of the safety net in the states or in the places that you are currently partnering with?
Well, we have found that the safety net has been tremendously responsive to the current crisis. The federal government has quickly changed laws, issued waivers and guidances, and authorized additional funding. State agencies have done an amazing job implementing these significant changes at the same time that they have experienced a massive disruption to their operations and workforce. Just a few examples. All 53 states and territories have issued emergency allotments for SNAP, raising SNAP benefits for all households to the maximum level for 2 months and hopefully additional months. This injects nearly $2 billion a month into the low-income families as well as into the struggling economy. States have extended certification periods, waived interviews, and made other process changes. They've accelerated pilots to allow SNAP recipients to order groceries online. They're even issuing nutrition benefits to families who are not receiving school breakfast and lunch due to school closures. At the direction of the federal government, Medicaid agencies have stopped canceling Medicaid cases, doing redeterminations and other data checks, and have shifted their attention to streamlining these new applications that are coming in. There are plenty of things that we're concerned about too, with overwhelmed call centers, waivers that may jeopardize client rights, and the fact that we haven't gotten a boost in SNAP benefits for all households. So there's a lot of more work to be done, but overall the safety net and the incredible people who are administering it have really stepped up and gotten food on the table, healthcare, and other assistance to people during this crisis.
Thanks very much, Jen. Leo, at Change and Innovation, you work with states all across America. What have you been seeing?
Well, Dan, you mentioned at the start of the conversation that we have 22 million Americans on unemployment. And if we learned anything from the Great Recession the last decade, is that over the next 12 months, 7 out of 10 of those families will end up receiving Medicaid or food assistance through the states. So really the bottom line is that more families than ever before are finding themselves needing to access the safety net services that states manage. And really the other side of the equation is that states are also anticipating significant drops in tax revenue as fewer people are working and spending money in the economy. So really what we're seeing on the states is this perfect storm of a larger number of families needing help as states are having to figure out ways to reduce their resources. And in a sense, this is really what we call a classic capacity crisis. Where state agencies have having to manage a much larger workload with a much reduced bandwidth to do these things. So in the states that we work with, I gotta say, you see reactions and responses in multiple spectrums. You see states like Nevada, Washington, Texas, that in a matter of a week, they responded to the social distancing guidelines. So they limited access via walking into local offices, but they have the right service delivery model and the right processes that within a week, they were able to connect their workforce remotely and begin serving families without skipping a beat via their other virtual access points, right? Via their call centers, families applying online, and those kinds of things. So like Jen mentioned, states are responding really, really well. But definitely you see the difference between those that have the right service delivery model that have reacted to capacity versus those that may have a more traditional way of serving families.
Great, thanks, Leo. And I know that you're working closely with Robert in the state of Nevada. Robert, how are things going in Nevada?
So in Nevada, we were very lucky that we had technology before this and that we were able to move the majority of our workforce to work from home. And our partnership with the Change Innovation Agency, our technology is already there. So we did not disrupt our services. We had to change our services. And by adopting the waivers that Jennifer talked about, and we took a hold of every waiver that we could. We went to an all hands on deck model where every supervisor, every auditor, every trainer, every lead worker, we put them into the service delivery and suspended all those operations in our state. We were able to meet the need. Monday came to work, we went into our queues. The oldest queue that we had was previous Friday. We were actually only one working day of work was sitting there for us to do. So we are caught up in that aspect, keeping in mind that all Nevadans are eligible for the food stamp program. There are still people that are over income, and our food banks are reporting a huge drain on their resources. And some of our resorts continued payment for some of their employees. But the CARES Act unemployment, the $600 per week that those customers are starting to receive, are now moving those customers off of food assistance because they are now over income. So it's a double-edged sword. We are staying caught up and we are moving forward, and we're able to meet the needs of the Nevadans, but there are still many people that their income is much lower than what they're used to, but they're over the income limits. And because that $600 of unemployment is countable in the food stamp program, but was not countable in the Medicaid program, there is an impact to those families.
Thanks, Robert. So there's some interesting things that we're hearing there, in that there are still significant areas for policy to be more aligned and to be more aware of the different programs that are in existence and how they can be supportive of each other. And also that in Nevada, you had already been working on a focus on service delivery. You'd already been working on a more agile or a more responsive organization, and that enabled you to take advantage of the waivers that Jen was talking about. Tracy, how does that reflect your experience working with the state of California and beyond?
Yeah, so I think that what we're seeing in this crisis is a magnification of the conditions that were there before. And so if there was a preparation, if there was a real orientation towards customer service, we're seeing civil servants who are bending over backwards to try to work miracles right now. And I don't want to discount that. But I think that we have seen, if there is sort of deferred maintenance, whether that comes from orienting those systems before, in a state as diverse as California, just looking at policies that had been passed over the past few years, really scaring away immigrants from benefits to which they are eligible, has chipped away at people's trust of those systems to respond to them in need. And so I think what we're seeing right now is really a test of the trust that people have in government to be there in a time of need. And in some places, those are responding quickly. In California, we are seeing a longer days to determination than what we're seeing in Nevada. And I think it took a while for some of those policy simplifications to catch up so that people could have that process smoothed out. So I think we're still catching up a bit here. What we see through Get CalFresh and people applying for food assistance in California is that March was tough to get on top of. March, we were hit really quick and fast, and we have a county administered system. So it takes we have 58 counties, there's 58 leaders who sort of need to shift at the same time, and that type of coordination is difficult. So I think as much as we're seeing these policy flexibilities and the government stepping up, from the individuals that we hear from on chat and via email and our daily communication, is that these systems are still confusing. They're still siloed, the rules are different from program to program, and a lot of people are reaching out for help and still kind of facing confusion and feeling like their situation doesn't quite match the programs that might be available for them.
Thanks, Tracy. So I think there's a couple of themes that are coming out, especially with what Leo, Robert, and Tracy were just talking about, which is that there were insights and there were some potentially strategic changes to process, to program, to policy that were already in place, or that departments and organizations were already aware of. So perhaps Leo first. I imagine that there's a lot of knowledge, or there had been a lot of knowledge already before this COVID-19 crisis hit, that we had already learned about how we can make social safety net services more human-centered, how we can help make them more customer-centric and understand and meet people's needs better. What are a few of the things that we already knew about that were best practice that perhaps, unfortunately, it may be that it's only in a time of crisis that changes like that actually have the space and the room to get pushed through?
Yeah, absolutely. Look, we're estimating that the number of families receiving Medicaid and SNAP will increase no fewer than 50% over the next several months as the unemployment rate continues to increase. And as we mentioned earlier, what that does is that creates a very severe capacity issue for agencies, right? More families coming in, fewer staffing resources. And really the number one solution in working with the 40 state human service agencies that we've worked with is that it's really understanding what is the issue that erodes capacity to begin with. And in the states that we worked with, this was generally the event that you will see. A family will apply for benefits, and in the course of 20 days, the agency would make a decision. And in the course of those 20 days, the customer will have to interact with the agency 3 to 5 times. Whether it is to apply, to show up for an interview, to then return verifications, to call and find out the status of their case, and eventually the agency would make a decision. So what's interesting is that the number one solution that states have put in place to, in a sense, manage the increasing workload is that regardless of how the customer is reaching the agency, whether it is in line or line or through the call center. The solution is to make sure that we connect the customer with the expert worker who is going to make a decision 7 out of 10 times, as opposed to, in a sense, sending the customer away to come back at a later time. And what's interesting is that we know that when we start something and we do not finish it, we're adding 10 to 20 days to the determination process. We're guaranteeing 2 to 3 visits from the customer, whether they're virtual calls or in-person calls, and we're adding collectively 2 more hours of work time for the agency. So in every agency we've worked with, and most recently we worked with a state agency in the Southeast that was managing around 100,000 initial applications and renewals. Of course, that's gonna increase over the next few months. But when you went and began quantifying the number of calls and visits and additional interactions, the agency was managing about 500,000 of those interactions. By really applying first contact resolution and making sure that we connected the agency and the worker with a decision, they were really able to free up the bandwidth of about 300 workers that were able to process 40,000 more applications. So really having a model where we have fewer pending, fewer handoffs, more streamlined processes, and really making sure that we complete cases the first day every time has been the #1 strategy in these 20 states to help them be in a position to regain capacity. Really, this has been the formula for Nevada and Washington State and Texas, states that are the flagship programs in providing services the same day.
And Robert, I'd like to briefly hear from you and then move to Tracy.
So the concepts that Leo was talking about really were put into place in Nevada during the Affordable Care Act. The Affordable Care Act was our crisis where the capacity was far outgrowing our ability to process cases. Nevada was one of the worst states in the nation when it came to timeliness until we adopted those processes. I also think it's important to point out that Nevada is a smaller state and we're not county run, we are state run. Every single eligibility case manager works directly under me. We've got me, 1 regional manager, and then our offices. So we're able to move a little bit faster. And when we adopted the processes that Leo talked about, we were working through 1 chain of command. But that first contact resolution where we make the determination on the first time we speak to the customer, we're doing that an average of 77% of the time because of the new processes. So when we do that 77% of the time, when we used to only do that about 20% of the time, that's 57% of the people that aren't coming back to talk to us again. They have their benefits that meets their needs, and we don't have to duplicate our efforts, spinning our wheels for that 20 days that Leo talked about before we get to an approval process.
Yeah. And then there were 2 more things really briefly that Nevada did very well. The first one is that they provide customers with additional choices to access the full scope of services virtually. So traditionally, you would have to walk into an office in Nevada to seek access to safety net. Now you can call their full scope call centers and really receive the same level of access. This second thing, actually the third thing after first contact resolution, is that they introduce consistency in workflow, consistency in process, consistency in practice. And when you have multiple access points for customers, once you have first contact resolution and consistency, then Robert is able to leverage his statewide workforce so that he's not dependent on a single office to meet local demand. He's really leveraging the statewide workforce to meet the needs of all folks in Nevada that same day. And last but not least, there is a much different set of data that Robert needs to manage an operations when issuing benefits in 30 days versus issuing benefits the same day. So access to the right metrics real time so that he can fluidly shift his resources to where the demand is greater is really the 4 key elements of the successes in Nevada and the rest of these states across the country.
Great, thanks Leo and Robert. So in the context of that, in the many years when I was editorial director at Code for America was working on Get CalFresh, which has now become one of Code for America's flagship programs. Tracy, can you talk a little bit about Get CalFresh and the design patterns and the user research that goes into that, and how that has led to the Code for America blueprint on human-centered social service safety nets.
Unmute myself. Get CalFresh, for those of you who may not know, it is a digital SNAP application assister. It's actually an outreach and assistance tool. It's not the application of record for SNAP for the state of California, but we do work in partnership and in contract with the state of California in order to provide that service in all 58 counties. And that grew from a small project. It didn't start out like that. It grew county by county as a way to really help people get an application in for SNAP or CalFresh in California without having to go in person or wait in the lobby, or without having to make it through like an 18-page paper application, which sometimes is really confusing for people, and maybe not all questions are necessary in order to get the benefit in a quick way. And so we really started by opening a digital platform so that people could submit an application for SNAP with some minimal information to get them through the front door. And over the years, we really evolved and grew that, both by researching what actual clients and applicants need and what they understand those questions to mean. We kind of translate the meaning of the questions so that we view Get CalFresh as a conduit of how an applicant provides the right amount of information. They understand the questions being asked of them, and it gets that information to a caseworker so that they have the core information needed to grant them eligibility and move forward. And that takes getting to a careful balance. You don't want to ask too few questions so that people are lost at the beginning, and you don't want to ask so many that you screen them out from even applying. And through that, we also do client tracking through the 30 or 40 days. Sometimes it takes a little while in California to get benefits. We text people back and forth. We email. We ask, have you had your interview? Did you send in verification documents? What was confusing? This opens up a whole channel of communication and real-time data. Like Leo mentioned, an administrator really can't make informed decisions unless they know what their clients are actually facing. And sometimes the type of data that we collect that's required by the federal government doesn't tell you the full story of what's happening in that process. And so we really learn what the applicants are facing. We share that information and data with the counties, with the state, with outreach providers, so that if we see, for instance, in California, we do have quite a high rate of what's called procedural denials, which is people applying and getting denied for benefits, not because they're ineligible, but because they've missed a step in the enrollment process. Most of the time that's because of a missed interview. And so by being able to look in and find out why, did someone just miss these phone calls? Is everybody just not picking up the phone? In talking to people, we did find that 45% of those people tried to reschedule. And so there, that illuminates, like, this is a connection point that we need to hone in on. And by seeing that, then we're able to actually address the problems that impact clients the most, and provide that data and information to our government partners as well.
So Tracy, I think there's a really great link here between, you mentioned the instrumenting of the service Get CalFresh, and Robert and Leo have mentioned this as well about the availability of real-time data. I know that Tracy, you've been working with Jen over at CBPP. So Jen, how has that availability of real-time data, how important is it, and how critical is it to informing policy recommendations at the federal level?
That information, whether qualitative or quantitative, is very influential as we, push for waivers or different things in legislation to increase access to the safety net. And you'll see how that's played out. Not that we're the sole influence on these factors, but looking at the continuous coverage requirement under Medicaid, requiring that if states are going to get an increased FMAP, an increased federal match for their Medicaid expenditures, that they can't terminate anybody from Medicaid right now. That's out of recognition that oftentimes paperwork barriers and inaccurate data matches that show what income was weeks or months ago and don't reflect the current situation, and hassle, very difficult redetermination processes lead eligible people to lose benefits. And that's in the normal course of business, and obviously compounded during this crisis and when state agencies are struggling. So that provision that lets people stay on and frees up state resources to focus on applications. The things Tracy mentioned around the various obstacles to SNAP, has influenced requests at the federal level and from states to waive interviews, to streamline processes in other ways. And it's also recognizing where the feds have not gone far enough. So the emergency allotment I mentioned, raising everyone's benefits to the maximum allotment, is huge and beneficial to many people. But something like over 40% of clients or households are already at the maximum benefit and are not getting anything additional. And these are the lowest income and most vulnerable houses. And that's leading to a push using data and other information to request a 15% bump in SNAP benefits to serve those people, others who need additional benefits, and to really stimulate the economy during this time. So all of that data, all of that information and knowledge about client barriers and where the system is not quite doing enough is really influencing how we push the federal government to respond to this crisis.
So Tracy, one of the things that I'm hearing there from Jen is that the value in instrumentation and getting that fine-grained information about when applicants are dropping out or where they're having difficulty with the process. I'm seeing in the chat a lot of questions about there must surely be duplication of questions. There must be not only within applications to specific services, but also across common services that you would expect to be applying for. So how does that instrumentation and that data on where people are dropping out, how has that directly affected policy and the way that those questions and documentation have been used in California? Are we seeing changes because of that?
So I think that we're seeing changes. I think they tend to be changes in process before they become changes in policy. And I think one of the things we've learned both in California and in our work in about 5 other states nationwide is that the same kind of simple steps that help you through this process are sometimes confused by policy that gets highly specific about one program and doesn't align with others. So sometimes like the best intentions to improve one thing can actually make connections to another program harder. So there's a lot of ways in which we really support like asking the question once and feeding that information into multiple programs at the same time, rather than asking someone 6 times, what was your income, and in 5 different ways. And people might inadvertently think they're answering correctly and get caught up by not understanding or having repetitive questions. And so through our integrated benefits initiative, we have really worked on streamlining and making connections between those programs so that, you know, as a human, as a person coming in, I'm telling you, I just lost my job, I had my hours cut, I have 2 kids. These are the challenges that I'm facing, and we should then be using that information to input across programs. That's something we did in partnership with Sevilla and the state of Michigan in redesigning their integrated benefits application. We're currently working with Minnesota on a similar project, and really finding that if you try to provide those many welcoming doors and make these programs easier to understand so that people can make informed decisions as they move through, it smooths the process for real people who are in their own personal level of crisis at times when the system may be smoother than right now, and it definitely helps the system and caseworkers respond when they're facing the volume and crisis on both sides right now.
Dan, if I may add,
yeah.
I do think there is a difference between improving the user interface of customers with these online platforms versus what the agency does once the request comes to them. So you might, and I gotta say, you need both, right? You need to definitely for people to apply, but if the outcome of the receipt of that application is that we're scheduling an interview 5-10 days out, and that the outcome of that interview is you having to come back, we definitely need to address those process challenges. Like we always say, it's not about managing the hundreds of thousands of calls that are coming into your call center. It's about eliminating the reasons why people are calling to begin with, right? So it's having those process and practice solutions so that when somebody applies, the outcome of that interaction, whether it's in person, over the phone, or in paper, is actually a decision. Those are the things that are going to help jurisdictions like the District of Columbia, that is receiving 3 times the volume of applications today that they received last month, to be able to serve people in their communities.
So I do want to get into some specifics now, and also to make sure that we've got time for to address some of the questions that have come up in chat. Leo, you mentioned this principle of first contact resolution, which I think you were kind of getting near to in what you were just talking about, in terms of internal process change and what would be needed to support that. Could you and Robert briefly describe what you mean by that, by first contact resolution? And if you had the opportunity, you know, in the work that you've experienced, and you're meeting with a director for social services, or you're meeting with a program manager, and you were able to recommend, you know, what are the 3 actionable things that are common that you could see that they could put in place today and that they could talk with their staff about we want to get this started now, what might those 3 things be?
Sure. So really, first contact resolution is a set of processes and practice changes that drives the agency to provide same-day service when first interacting with the family. Examples of that is that traditionally, when you apply for benefits, the outcome of you first starting that case, if it's one of those programs where an interview is required, is that you schedule an appointment. And you're definitely scheduling appointments 5-7 days out. No one's working the case during those times. So really, one of the process solutions that we recommend is that as soon as that application comes in, call the customer. Call the customer once. If they don't answer, leave a message telling them, hey, this is Robert from the Department of Public Assistance in the state of Nevada. I'm calling you to do your interview. I'm going to call you right back in 5 minutes. And when you make that second call, you're going to reach customers 6 out of 10 times. And you have now shaved 10 days from the determination process. Likewise, once you have Robert and the customer doing the interview, is really making sure that you're spending enough time to finish the case as opposed to pending. Workers really are, they begin sensing that workload is increasing and they hurry up so they can get to the next case. But again, what's interesting is that every time we don't finish, we're then adding 10 more days, 2 more hours of work. And guess what? If you were to spend an extra 10, 20, 30 minutes with each case, you in a sense are regaining capacity by not having to manage the multiple interactions. Having a consistent set of interviews, tools that enables that consistency in practice, and a process that lays out what are the things that workers have to do to finish a case instead of pending. So that would be the second practice benefit. And last but not least is really once you're able to regain that capacity is in a sense opening the ability to provide services to families via virtual access points. So instead of having a call center that just answers the status of questions, have the call center provide interviews and process cases so that customers don't have to walk into your office and create bottlenecks that continue adding time. So generally anything around scheduling appointments, finishing the case not pending, opening your multiple access points to provide services, and then leveraging your statewide capacity is what enables you to really regain that bandwidth to maintain an ability to serve 50% more families in the next 12 months.
Yeah, and Robert?
So I think it's important to, I've been in social services in Nevada for over 25 years. And Leo, I was an office manager when Leo's team came in and told us that we needed to stop doing interviews and meet with every customer when they walked in the door and provide face-to-face immediate service. And I told him he was out of his mind and there was absolutely no way we could stop booking appointments. We were too busy to do that. But I was overruled and I was forced to do it Leo's way and it worked. And I had to swallow those words, and I've promoted twice since then. And I look back at those days and I think he was right. The number one saving capacity that we did is we stopped booking interviews and we do walk-in service. When we tracked how many times people didn't show up for their interviews and how much time we were spending rescheduling those interviews, and then the number of people that were denied for not coming to their interview and they were reapplying 2.5 times, it was wasting all of our time. And it was very difficult to get to. It took 2 years to implement all of that. It's not something that I would recommend states try doing during a crisis like this, but it worked. And then the other piece that Leo talked about, to put it in practical aspect, when our employee is in meeting with a customer, if we can get the information for them, we do it. We get on the phone and we call the bank with the employee or with the customer. We call the landlord. We call employers to get that information faxed in, or we use electronic databases to verify the income. And 77% of the time we're successful and we're able to approve that case without the customer ever coming back. Prior to that, we tracked it and we were touching those cases an average of 6 times with the customer just calling us and saying, where's the case, where's my money, I need this food stamps. And we were spending all of our time answering the phone and working case. So those are the two things for me, that we work it, the worker does all of the work, and it takes about an extra 20 minutes for the worker to do that, but we save 40 minutes on the back end. And I had difficulty visualizing that until it actually happened.
Yeah, Dan,
Right.
in most service delivery systems across the country, for every one person initiating a service, there are 4 other customers who are chasing the progress of their application. And it all goes to what Robert just said, having a very consistent process to follow that enable workers to finish. And what's interesting is that often we think we don't have the time to help the customer attain the verifications that they need, when we really cannot afford not to do those things. Again, the extra 20 minutes will save you 2, 3, 4, 5 visits and 20 days in the determination process.
Yeah. Thanks, Leo.
We went as far as to create standardized notes for the workers to put in. And once those notes were finished, we went back and re-looked at every note, and we found there were places that we could remove 6 words in the notes. But we enter those 6 words 125,000 times a month, and ended up saving about 2,100 minutes a month by reducing 6 words, which was the same as hiring 3 staff members.
Right.
So we keep working with those processes and keep fine tuning them to the best of our ability. And we're not perfect. We're far from perfect.
Yeah.
We have so much work that we could do differently, and we work at it every single day trying to find those. But this amazing team that we have, these 1,000 case managers and another 1,300 people supporting those case managers, they're really committed to the work that we do, and it's amazing to watch them, especially during this crisis, just want to jump in and help families.
So we are at 9:45. We've got about 15 minutes in our left in our schedule. So what I would like to do now is to jump to a, it's pretty funny because it looks a bit like a game show on my screen. I have all of you in squares, and that makes me think that we can move to a quick fire question and answer round, where I'll be awarding points to each of you for how quickly and how concisely you can answer each of these upcoming questions. One of the ones that has come up repeatedly, and I think is incredibly important, is how is the digital divide and equitable access being addressed? So who wants to go first?
I can jump into this one, because I think it's a really important point to make. And I think that recognizing that people are going to need services in multiple ways, when talking about technology, we're not saying that technology should be the only way for people to access services. It's not saying remove the in-person lobby or remove a call center where a real person talks to you back and forth in conversation, but it's making sure that those multiple doors are open so that someone who can access is able to move through quickly. I've spoken with many people who say, no matter what, I want to go in person. I want someone to see me. I want someone to hear my story. Like, I want them to see me. And I think that with our digital tools, like, technologically, we need to, one, make sure things are mobile friendly. We need to recognize that people, the digital divide sort of branches many areas, both rural, looking at poverty, looking at broadband access, but many people are on their phones, and many websites that are created are not mobile friendly. And so people's main points of internet is not accessible. But if we can sort of triage and move people who are comfortable to using online to that process, you then open up phone lines and lobby space and that capacity for people who want that person-to-person contact. Because even with, like, across the digital divide, I can say one thing is universal, is that people don't want to just be connected to a computer. They want a digital tool that's connecting them to a person. They don't, no one has said, I would like my case to be determined by an algorithm. But what they do want is to be able to move through quickly, to be able to use a digital device that they have accessible to them as a point of contact, so that they can get what they need and move on from there. And sometimes that's human connection, and sometimes it's just speed. And we need to make those different opportunities and opening doors welcome for everybody, regardless of where they're at.
Great. 5 points to Tracy.
Yeah, I will add, Dan, that technology is not going to fix this capacity crisis.
No.
And we definitely need to ensure that we continue giving customers multiple ways of accessing services. And that's what the most successful states do today. Putting aside the lobby issues that right now do not exist because of social distancing guidelines, we still need to enable to have people apply online, call in, mail in a paper application. But regardless of how that request comes in, the process is the same. Goes to the worker who finishes the case.
Absolutely. So my next question, we have a really great upvoted question from Justin King in our Q&A, which is, we've heard about some of the conflicts. So if you're a software engineer, this is kind of the equivalent of an exception being thrown when someone makes an application for unemployment insurance, and then it turns out that that's in conflict with another piece of social safety policy or program. Jen, I'm going to go straight to you on this one. What are you seeing there? What's horrible that you're seeing there, and what needs to happen? Or I imagine, are you in the middle of writing the policy recommendations to smooth that out right now and getting back to it after this webinar?
It's complicated, and we've dealt for a long time with different conflicts between the different programs, how they look at a household, how they look at income. The UI is a current example where the $600 a week bump that people are getting is not countable for Medicaid, is countable for premium tax credits, and is countable for SNAP. And so agencies that have done a good job integrating, either vertically with Medicaid and premium tax credits or horizontally across SNAP, Medicaid, and other programs, are facing that conflict. And this is a place where I think technology can come in and can sort. Okay, here's the data feed coming from the unemployment agency. You know, is it clear that there's a $600 a month added, and how do we count it differently for different programs? Because the last thing we want to do is go to a client and say, is this pandemic unemployment? What's your base rate? And things like that, and ask them to sort it out. We can take that on, and we can do that. And I think states are really looking to do that and to kind of mask that conflict. The other challenge is that there are multiple benefits coming available for people, and that's great. And how do we kind of sequence them and balance them? So people may have applied for unemployment, and that's great. They're going to get cash in their pocket that's desperately needed. But when is that coming? Some states are understandably very backlogged. So they should be applying for SNAP and Medicaid as well. And in some cases, they're going to get those benefits, then they're going to lose those benefits when the unemployment kicks in. And then at the end of July, when that supplemental unemployment runs out, they're going to be coming back in for SNAP. Ideally, maybe a state can suspend them during that period so they don't need a new application. But those are places for coordination and as much information, technology, and just kind of working across those programs that the state can do, that'll help the clients navigate this complex situation.
That's great. Thanks, Jen. And I imagine if you could have given a better answer or solved the problem inside of 5 minutes, then inside of 3 minutes, then we wouldn't necessarily be here right now. Another great question that I saw was, and I mentioned this earlier, is how are we addressing service workers' needs and experiences? So if you're a frontline worker dealing, if you're a caseworker, and I'm going to go to Robert on this one, you're in a traumatic situation already. You know, your working situation has completely changed. You may be feeling even greater emotional and professional pressure to deliver because you want to meet people's needs. What do you do? I've heard some fantastic stories about how you are empathizing with and motivating your team. Can you talk a little bit about that?
So yes, so in Nevada, like I said earlier, we were lucky enough that we were able to move about 75% of our workforce to home in a matter of 4 days. The problem with that became that 75% of our workforce was now at home and fragmented and disconnected and no longer had their human connections every day and weren't speaking to everybody. So so the first day of all this, I sent just an email out to my team, a shout out, thinking of you. We're all in this together type thing, right? And then I sent a little, this is what we did yesterday. Here is our case management data. Just want to let you know what you accomplished because you're accomplishing so much. That very organically turned into what is now a daily newsletter. I'm also working from home, so the time that I used to spend in my commute, I'm sitting and doing a daily newsletter to these staff members. And I work very hard for it to be, some of it is very professional and some of it is slang and some of it is humanistic and some of it is shout out to these people. And then I emailed them and said, am I wasting your time? Because I don't want to waste your time. And frankly, I don't want to waste my time either, right?
Right.
And I received hundreds and hundreds of emails back that said, I get up every morning and this is what I read when I have my coffee. So I feel connected to DWSS and I feel connected to my case managers. And I'll tell them, kudos, this is what we worked on yesterday and you broke these records and this was amazing. These are our risks and this is what's coming around the corner. And those newsletters have become part of, and we no longer call it a COVID crisis in social services. We didn't want that crisis negativity to it. We just refer to it as a different work model. And I think we adopted something called OCM, which is organizational change management, but it also stands for us, it was online call center and mail-in applications, online call center mail-in. So OCM became our adopted model for this, to just say, we're in this together, let's panic, we're working from home, we're very lucky that we're able to work from home, and we can serve the next customer. And in our task management model, our case managers only have one task at a time to work on, and that's what I keep reminding them, that they've got one person in front of them, whether it's virtual or the human being, and we keep going forward together.
Great, thanks, Robert. So we are at 5 minutes before the hour. So I think, fingers crossed, we've got time for 1 or 2 more questions. And I have one here that gets a little bit deeper into the implementation side of things. Are any of you aware of anything like a formal data strategy or data governance initiative that kind of underpins this kind of both internal service redesign, process redesign, and optimization work, and also on the user-facing side? No, is the easy answer there. My glib response to this is probably that I can imagine with the state of social service IT systems, in the best of times, that people are primarily concerned with keeping things up and running and keeping them up to date with current policy changes. And I think this maybe ties into my second question, which is, for each of you, I'd like to hear a little bit about what you think is coming next. What can we expect to see over the next 2 months, over the next 6 months, and over the next year? And I will start with Tracy first, and then we'll go at least clockwise round on my screen.
Sure. So this is kind of a heavy question. I don't know that I have a crystal ball into what this year looks like. I think that at least for the next 2 months, we all have to be prepared to be trying to navigate this uncertainty as gracefully as we can. I think within 2 months, it's unrealistic that we're going to get to these larger system change. I think asking about like the data infrastructure, folks have been trying to work on horizontal integration of data interfaces for a very long time.
Yeah.
And it is a challenge that shouldn't be as hard as it is, but it is. And so I think that we need to be looking at what are the short-term ways that we can truly be more human-centered. How do we understand the perspective of what our clients are facing? I see Terry Ricks, I think, is on this webinar. She's done a fabulous job in the state of Louisiana, and actually right now has an advisory committee, a paid advisory committee of SNAP recipients who are really providing feedback and input to the State Department. I think things like that in the short term that really break down the divide between who's receiving and asking services and understanding what's needed will help us build the roadmap to where we're going in the longer term, because I think we're seeing now that these systems do need to be more flexible. We do need to invest in their agility, even in good times, because oftentimes during the good times, we let maintenance lag. And so I think right now we need to really move forward and accelerate this window of opportunity to moving towards more resilient systems in the longer term, because we don't know how long this is going to last and how long the economic impacts will ripple.
Right. And Robert?
So, concerns that I have are over the next 2, 4, and 6 months. Over the next 2 months, we have to open our lobby doors back up and keep social distancing in place to protect our workers and protect our staff, or protect our customers. And we're looking at buying equipment to do that. We are processing approximately 30% more casework today on a daily basis than we were prior to these office closures, but we can't maintain that. On June 1st, we have to start doing food stamp interviews again, and we're going to lose that capacity. And we've pushed out all the food stamps and Medicaid recertifications for months, and we have to do that work, and it'll start coming back. And then those customers are going to start applying. Unless there's an extension on the unemployment benefits, that additional $600 runs out in 4.5 months, and all of those customers are going to reapply. So while I see the next 2 months will be focused on social distancing and safety, over the next 4 to 6 months, the volume of need of social services in Nevada could surpass our ability to stay caught up in the volume. We've done a fantastic job. There were waivers and assistance put in place for the time frame that is not going to be maintained in the long run.
Great, thank you, Robert. And with 2 minutes to go, I'd like to go to Leo, and then we'll finish up with Jen.
Sounds good. Look, I think Jennifer alluded to this. The federal government enables states to auto recertify recipients for the last 3 months. The renewal workload equates to about 60% of workload in any of these human services eligibility shops. That workload would have eventually come back. Likewise, the policy benefits that the federal agencies have allowed will eventually have to be reverted because they have tremendous budget impacts on those programs. And local government will have to balance their budgets, which means that you're going to deal with 30–40% fewer resources to do things. So what we'll see in the next several months is things that will likely get worse before they get better. And the message here is to look, this is the time to redesign your processes. This is the time to embed first contact resolution into your workflow. This is the time to begin working towards how to expand your multiple access points, because right now we're not dealing with some workload that will hit us in the next few months, definitely before the end of the year. So the time is now to react to these things.
Right. And Jen?
So as has been mentioned, I think we have some concrete things coming in August after the extra unemployment expires, when some of the other waivers and extra provisions from the crisis expire. But we really need to be looking ahead to, what simplifications have worked during this crisis, and we need to push for them to stay. What was necessary in the time of crisis, but needs to return to kind of normal after. And really look at how has the crisis allowed us to cut through red tape in a way we can learn from. We've seen states that have never had a cash assistance application and said it was impossible stand it up in 2 weeks. We've had massive expansions of telehealth, using presumptive eligibility to get people on Medicaid really quickly. What should the system look like in the after, and how do we take steps now in policy and operations, in funding, and all these things that come together to really try to kind of build that vision that we've long sought.
Thank you, Jen. So we are at time, just only 1 minute over. I'd like to thank all of our panelists, Tracy Patterson, Leo Ribas, Robert Thompson, and Jen Wagner for joining us today, and also all of our attendees. Thank you everyone for doing the work that all of you do every day to ensure that we deliver better services for all Americans. Today's webinar has been recorded. We'll be sharing it on YouTube in the coming days, and look out for more events and stories from Code for America as well. If possible, please consider supporting Code for America's work with a donation. Code for America is a 501c3, and also follow us on social media and on our blog for more updates and our efforts. We have kept a copy of all of the questions that were submitted during chat, and we'll be taking a look through them. And if there's opportunity for our panelists and others to put together some more information about those questions, then we look forward to doing that. And again, thank you very much.
Thanks, everyone.
Bye-bye. Thanks.